Doctors by definition are people who are skilled in the science of medicine. They have medical degree and job is to treat people who are ill or hurt. While doctors are behind most medical studies, they sometimes become the subject. Let's check out top 5 disturbing facts about doctors. So let the countdown begin. The Netherlands has allowed doctors to euthanize patients since 2002. The act is legal when an individual suffering becomes unmanageable and consent is irrefutable. Recently, a Dutch doctor was dragged to court for the first euthanasia to turn into a criminal case. The prosecution felt that the patient could not give proper consent. The 74-year-old woman had severe Alzheimer's. However, 4 years ago, she wrote a statement detailing the wish to be euthanized rather than ending up in a care facility. There came a point when her physician decided the time had come. 2 other doctors then reviewed the situation and agreed. A date was set and the doctor, the patient, her husband, and grown daughter had coffee. The 74-year-old's drink was laced with a sedative but it failed to knock her out. Another dose was given via injection. She slept but just as the doctor was about to give her the second and fatal injection, the woman woke and stood up. Her family held her down and the drug was administered. The court eventually acquitted the doctor, saying that the deeply demented state of the patient prevented her from verifying her death wish that day and that the written declaration was sufficient. During certain brain surgeries, the patient must stay awake. Doctors talk to them to ensure that some regions, like the one that handles language, remains unaffected. Needless to say, some people panic after waking up from the initial sedative and reality hits. You know, your head is locked into place, a piece of skull is gone and your brain is open. Patients have been known to panic, grab at their brains or fight the head brace. In 2018, an epilepsy patient underwent the procedure. Usually, sedation and distraction keep patients calm. This time, the doctors went the fun route. It did not start out good. When the woman woke up, she was so anxious that she cried. Something needed to be done before she became too distressed. The idea was to make her laugh. Instead of clowning around, the doctors stimulated a group of brain cells called the cingulum bundle. This region was believed to control the mouth muscles during laughter but that it had nothing to do with emotion. As her doctors had hoped she would, the woman proved conventional thought wrong. She laughed her way through the surgery. In 2018, 6 pediatricians wondered how long it would take a Lego piece to move through the digestive system. The doctors, all from the United Kingdom and Australia, chopped off the heads of Lego people and swallowed the toy noggins. From there on, things got a little weird. Each scientist had to pick through their own poop to find the toy part again. To lighten things a bit, they came up with fitting tags for their rating systems. For days beforehand, and during the retrieval phase, they graded stool consistency with the SHAT, stool hardness and transit, scale. Whenever somebody found a Lego head, it gave them a fart, find and retrieval time. At the end of the day, 27 hours to 3 days were needed for a yellow face to pass through a healthy adult without any problems. SHAT scores also showed that stool consistency remained unchanged. This information can now be added to the rare pool of studies researching the direct effects of swallowed toys. However, everyone is probably still wondering why one of the 6 pediatricians never found his Lego head. In 2019, an Australian patient underwent an emergency procedure. It was designed to correct a tear in his aorta, not cause a fire near the chest cavity, which is exactly what happened. The open heart surgery started out normal enough. Unfortunately, the patient's health problems started a series of events that lead to the fire. The man had an enlarged lung and when doctors accidentally punctured it, they had to compensate for the air leak. They did this by increasing the amount of oxygen in the anesthetic. Since the patient inhaled the anesthetic, both the oxygen and sevoflurane sedative escaped through the lung leak. The surgical team could smell the volatile mix in the air. A spark from an electrocautery device landed on a dry surgical pack on the patient's chest. In the densely oxygenated air, the pack combusted. The fire was extinguished and the operation concluded successfully. It was not a one-time freak scenario. This was the 8th chest cavity fire caused during surgery. Just like the Australian case, they all included lungs, electrocautery devices, increased oxygen, surgical packs, and unscathed patients. In 2019, DNA samples were taken from 250 doctors at the start of their internship. A second DNA test was done at the end of their first working year. The results were disturbing. The first 12 months on the job rapidly aged the new doctor's DNA. In comparison, other people needed 6 years before their DNA took the same toll. The scientists found the surprising fact when they looked at telomeres, which is often referred to as the tips on chromosomes. It is normal for telomeres to shrink with age, but it would appear that occupational stress accelerated the process in the interns. Doctors who worked the longest hours, displayed neurotic personality traits, or had tense family situations showed the worst aging. Why does it even matter? Shrinking telomeres is not a good thing. It spikes the risk for cancer, heart disease, and declining mental capacity. Researchers are hoping the study's results would help reform the brutal hours that doctors face during training and beyond.